Now lastly, and the best for last, the CDC. As I mentioned, my first trip to Africa was 2002, where I ran into in Ethiopia, in Addis Ababa, downtown Addis Ababa, an individual at the hotel I was staying in who knew my name, which kind of surprised me when I was in Ethiopia. I was surprised anybody did. I found out they lived right out here on North Decatur Road and worked for CDC, and they were in Ethiopia. So I, at that moment, realized this is not just Georgia's greatest natural health asset, it is the world's greatest natural health asset, and that's why CDC was so fortunate. But also what President Bush initiated in 2002 with the PEPFAR program and an initial appropriation of $15 billion is making remarkable results in the continent of Africa. Let me just give you some examples. 5 years ago, most children born to a mother with AIDS were born with AIDS themselves. Today, because of early identification of pregnancy and because of the cultural changes that CDC and PEPFAR and the World Health Organization have made in attitudes in Kenya and Tanzania and Rwanda, women go in for tests. If they're HIV positive, the drugs are provided to keep the child from developing AIDS. And so while we visited orphanages of children with AIDS whose moms had died of AIDS in Kenya and in Tanzania, today that is less and less of an occurrence as long as they're getting tested because of the PEPFAR program and the early diagnosis. In Dar es Salaam, to let you know what a change it's made, we went to the home of one of CDC's clients who was a 70-year-old woman who 7 years ago, or she thinks 7 years ago, was infected by her husband. She went in for testing 4 years ago when she got to be feeling very sick, which is when she was tested positive for HIV. She was put on the retrovirals and is living a normal life at the age of 70, thanks to the taxpayers of the United States, the early diagnosis by the CDC, and the pervasive investment in preventing AIDS and AIDS relief in the continent of Africa. In the 3 countries where CDC's prevalence was so high, where they were not that prevalent in the Sudan for a lot of reasons, obviously, but in Kenya and Tanzania and Rwanda, the hundreds of thousands of people now on retroviral drugs who are living normal lives is just remarkable. And we went to counseling centers and health centers sponsored by the Catholic Church, sponsored by the Coptic Christian Church in Kenya, and others. We visited, sat down in rooms where we were listening to African women and African men talk about the things that the CDC had taught them to do that was going to save their children's lives. We're now, it's estimated, you don't know for sure because you don't know what the total number really is, but by people a lot smarter than me, we're probably reaching in Kenya, in Tanzania, and in Rwanda up to 1/3 of the infected people in the country, working towards getting to 100% of the infected people in the country, when at that point in time the bell curve will start to come down and the intent of the PEPFAR program will become a reality, and that we will begin to do to it what we've done to so many other infectious diseases in the history of mankind. You'll never probably eradicate it, but you certainly can make it a much less significant problem than it is today. CDC is also very involved in the President's Malaria Initiative. Malaria is the #1 killer of young people. 1 million people a year in Africa die from malaria. And malaria is preventable, but when it's as rampant as it is in most of those countries, it's very difficult to prevent. But thanks to the net distribution center where the treated nets are being supplied, most of the children under 5, not all, but a majority are now sleeping under a mosquito net at night, which is the best single protection. The largest cause of death for children under 5 is, in fact, getting malaria and dying from malaria in that part of the world. In Tanzania, meeting with the President of Tanzania and the President of Rwanda, the first subjects out of their mouths were the CDC. And the Malaria Eradication Initiative, which in Rwanda has been pervasive and phenomenal, but is beginning to pay big dividends in Tanzania. In fact, basically it's been eradicated on Zanzibar, which is the island nation off of Tanzania, but they got the benefit of being an island, so you have a controlled environment, unlike the larger, most expansive country of Tanzania. But what CDC is doing in early identification and testing in the distribution of the retroviral drugs and in changing the cultural habits of people in Africa.